A detailed lesson plan and PPE personal protective equipment for midwife student. Good morning, everyone.
Okay, class, before we start our discussion, kindly all stand and let's pray. In the name of the Father, and of the Son, and of the Holy Spirit. Our Father, who art in heaven, hallowed be your name, the kingdom come, the will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our sins. Amen. We can recall our topic class meeting. Okay, mister? So how about you, mister? Can you please tell me what is hand hygiene? Today's lesson for today. Anyone from this class? I think you don't have an idea. So today we are going to talk about PPE. So what is the meaning of PPE? Very good. What this personal protective equipment is about? Let me give you a brief description of PPE. PPE is refers to protective isolation gown, disposable gloves, face shield, goggles, protective buoys, hair cuff, face mask, or respirators, or other equipment that's designed to protect the wearer from injuries or the spread of infections or illness. And also, PPE is required for any potential infectious disease exposure. PPE is prevent contact with the infectious agent or the body fluid that may contain an infectious agent by creating the barrier between the worker and the infectious material. Class? So I will give you a video demonstration how to safely put on personal protective equipment, donning and doffing procedure.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility donning and doffing procedure.
We will demonstrate how to safely put on personal protective equipment, proper donning, and proper doffing procedure.
First, identify and gather the proper PPE to don, including the appropriately fitted isolation gown, a approved 95 filtering face mask respirator, or if a respirator is not available, you can use a face mask. A goggles, and if goggles is not available, you can have a face shield, and a pair of disposable patient examination gloves, and a protective booties, and also the hair cap or hair cover. Start by removing personal items like watches, cell phone, earrings, or rings. Visually inspect all PPE prior to donning to assure that it is not torn or ripped. Select the correct size PPE, ensuring that the gloves fit properly and her gown fall to mid-calf. Perform hand hygiene by using the alcohol-based hand sanitizer or washing your hand with soap and water for at least 20 seconds. Put on protective booties. This step is optional. Put on the isolation gown, tie all ties, or snap all snaps. Extend the face mask under your chin, protecting both your mouth and nose. If it has loop, hook them around your ears. If it has tie, secure them at the base of your neck and crown of your head. Midwives put on hair cover. It should cover all hair and the ears. Next, put on face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they can cover the rest of the gown. You are now ready to enter the patient room. As a midwife, except the room, she knows her PPE is contaminated. If the patient has a suspected respiratory HCID like MERS, SARS, or pandemic influenza, the PPE can be placed into the regular waste stream. Midwives remove the full face shield, leaving the surgical face mask or the N95 respirator on. After removing the face shield, midwives remove and discard the hair cover if worn. To do this, she ties her head slightly forward and pulls it off. Next, she disinfects the inner gloves again. Midwives remove the gown by untying or gently breaking the fasteners. She carefully folds the gown away from her body folds inside out and place it in the waste receptacle. Midwives disinfect the disposable gloves and remove booties if worn. Next, she disinfects and removes her inner gloves, taking care not to contaminate her bare hands during the removal process. Midwives need to perform the hand hygiene on her bare hands. And now, she removed the face mask, taking care to not touch the front of the mask or the respirator.
Let the video demonstration class?
Yes.
Very good. Can you enumerate the different materials, equipment based on what the video represents, Mister? Okay, very good. You may sit down. Yes, you've already known what is PPE. Okay, class. So now we will going to have an activity. Yes, you've already known what is PPE. Okay, class. So now we're going to have an activity, and I think you are all ready for the short quiz. Kindly prepare one or sheet of paper to answer this following question. I will give you 15 minutes to answer this.
Three.
Time's up. Can I have your paper? For your assignment, I will give you a donning and doffing PPE procedure. We will have a recorded demonstration of donning and doffing personal protective equipment. This is your procedure. And present into the class next meeting. I hope you've learned a lot for this discussions and demonstrations. Please stand up for our closing prayer. Father and Son,